I try to do it differently on the left versus the right side for this case. This one, I'm going to do a buccolingual section and get the roots how like I normally do in most of my videos. The other side, I'm going to try horizontal crown section. Didn't go exactly the way I wanted it, but I wanted to try it 2 different ways to see if it made a difference. And when we get to that side, I'll show you what I'm talking about. I could have done it a little bit differently. So I can see a little bit of the tooth there, just creating enough space for my drill to make a good buccal trough. Here. This is my Woodson elevator, just kind of loosening up that tissue a little bit. And now I'm just using a 1703 burr, just making a buccal trough. My goal here is to create some space for the elevator and also get a sense of how this tooth is positioned. And so like I like to know the angle of it. It helps me section better versus just seeing a little piece of the tooth and trying to gauge the angle of my buccolingual section. Just putting the elevator in just to see, and obviously I'm not going to elevate it out, but it just gives me an idea if it moves a little bit or not. And this is just a standard buccolingual section, like I normally do. Not going all the way through the tooth, and I'm irrigating as I go, and then sneaking a peek here and there just to make sure my line is where I want it to go. And also for the camera, just so you guys can see it too. All right, let's break that off using my offset spade, or offset 77R, I should say. So it's moving, it's just wedged in there. So I'm trying to get that distal root out, or distal crown and or root. So now that's wedged, so I'm just going to take some of the crown off now. And so, again, I could have just taken the crown off and skipped this part, but this is what I'm doing. So this is just the distal crown. Removing that off the distal root.
Yeah, you missed that.
Just because everything's just horizontally wedged in there. All right, distal crown, get out of there. Now, let's get that distal root out. It's moving good. It's just wedged in. Just trying to get it moving in space where I can sneak it out of there and then work on the mesial. Creating a little bit more room with my trough, seeing if that helps, and it does. It's moving a little bit better. I think I got it moving a little bit more. Now I can maybe grab it. Sometimes I use a hemostat to grab it at this point, and I have my curved hemostat. A little slippery, but I think I could get it, get that weeder out of the way. And I should be able to get this distal root out. Pretty straightforward here. Almost got it. Got it. Alright, so now let's get that mesial root out. So elevating it up. And again, that's even more wedged in than the distal root. So now I'm going to take off the mesial crown. Again, why didn't you do a horizontal crown section, I guess, for those people? But you could do it either way. Honestly, I've done them both ways. It's just whatever works. Trying to split that crown apart from the root. There it is. So there's the mesial crown. Now that's out. So all the crown's out. Now there's just the mesial root. It's moving. Just trying to get it out of there. Grab my hemostat. Grabbed it out. All right, so now we can close that up. Now for the right side, and you saw on the X-ray, they're pretty similar impactions, horizontal, deeper impactions. So I'm going to do kind of this simple flap again, envelope in the front, little distal buccal release in the back. And like the other one, I can see a little bit of that tooth peeking through, but now we're going to create that buccal trough and expose most of that tooth. On this side, I did try a horizontal crown section first, and you'll see when I do it, in hindsight, I probably should have sectioned that crown off a little closer to the CEJ than I did. But I'm also using a straight handpiece. I don't use a contra angle. And sometimes there are some limits with using a straight handpiece in these areas. It's just getting that right angle to get in there is tricky sometimes due to a lot of reasons. So buccal trough, making sure I can see where the tooth is going. And I so wanted to just do a buccolingual section on this, but I'm like, I'm going to do it differently. So you can see where I'm starting this horizontal crown section. I probably could have gone down a couple more millimeters and did it, and I think it would have been a little bit better, but I still got the tooth out pretty efficiently. So now I'm splitting the crown off. And my issue here was the crown was still kind of wedged in there. Even when I split it from the roots, the crown is still kind of wedged in there because I cut it so closely. So I may have to, I think in this case I did split the crown again just to get it out. Yeah, so now I'm splitting the crown, kind of like a buccolingual section through the crown now, only, or the cut part of the crown. And I'm just getting the crown out like that. So not quite how I envisioned, but sometimes you just got to do what the tooth gives you. And now I got the distal part of the crown, and now this is that mesial part of the crown out. Trying to get it out. Still, it's popped right out. Very nice. Exactly how I wanted it. Now there's a mesial root and a distal root. Sometimes you can get them both out like this, so I'm trying. It's moving a little bit, but some resistance. So now, buccolingual section. So now I'm buccolingual sectioning, separating the mesial and distal roots out. I have a little bit more room now that the crown is gone to do this. And so I'm doing that, mobilizing that distal root. And that's coming out nicely. So there's the distal root. Little slippery guy. Good. Distal root's out. Let's get that mesial root out. Same thing as before. Just getting it out from where it's at in this little comfortable spot. It's been there forever. And again, this patient's older, probably mid-20s, so this isn't a young patient, so sometimes these teeth are a little bit more difficult to remove. There's that distal root. Or the mesial root, I should say, sorry. Yeah, it actually had 2 roots on it. So this tooth actually had 3 roots.
3 roots on number 32.
So that was not expected, but that's what happened. Cleaning it out, going to stitch it up. So that's how I did. I did both sides a little bit differently, but ended up being very similar towards the end.